Ladies and gentlemen, Honorable Minister Sayyid Imran Shah Sahab, Honorable Chairperson Sahiba, Senator Rubina Khalid Sahiba, Honorable Secretary Pius Naveed Sheikh Sahab, and the Honorable dignitaries, thank you very much for being here. मेरे जितने भी कलीग्स यहाँ पर मौजूद हैं, जितने आज के यहाँ पर जो शुरका हैं, थैंक यू वेरी मच वंस अगेन कि आप सब यहाँ पर आए और हमारी हौसला अफजाई की. So today, as we launch this dashboard, it will turn our Nashonuma program, rather a national promise, into something we can see, measure, and act on. Benazir Nashonuma is not only cash support, it is a pathway to healthier pregnancies, healthier infants and mothers, and prevent stunting. In the next few minutes, I will show you how this dashboard in our shared window into this journey, and it tells us where we are, what is working, and where we must move faster. I'd like to highlight that here everything begins with a secured access. Each user signs in with an official account so that the right people see the right information. This protects beneficiaries' data while still enabling transparency across implementing partners. The experience is simple: log in and move to the module you have been given access to, and as per your need, access the information. In short, secure entry, then instant visibility. Before I jump into the dashboard details, I would like to acknowledge the support, vision, and constant follow-up by our chairperson, Senator Rubina Khalid Sahiba, and the Secretary BISP, who could not join us here today because of his ailment. They wanted to have more visibility into the program implementation, particularly about the Nashonuma program. Their key ask has always been a simple one: have a platform which strengthens the coordination among the partners and monitor the progress in real-time basis. Now, with continued investment on the digital fronts, including this dashboard, we made the tremendous progress on digital payment system, grievance redressal, and the continue to strengthen our abilities so that we can work together with our partners. We solve problems together and accelerate impact against the poverty. This is the main dashboard, our command center for Nashonuma program. In one screen, we can see all the scale of the Nashonuma, the total number of beneficiaries, active mothers, active children, graduated children, and those who are waiting for the compliance still. You can also see what has been delivered, total disbursements, the network of facilitation centers, nutrition stabilization centers, and the reach of awareness sessions. Geographically, one can see the coverage and program delivery. For leadership, this means faster decision because the evidence is already in front of us. The power of this dashboard is not only the big numbers, it is drilled down. From the national view, we can zoom into a province and then into a district on the map. Each dot represents a location where the program is operating. And with a simpler hover, we can see key features such as enrolled beneficiaries, active caseload, disbursements, and the graduations. This is how we spot gaps, districts with low coverage, unusual compliance patterns, and how like the high needs wherever it is required. It turns geography into actionable management. As you see in this dashboard, the beneficiary modules is built for operational reporting. Using filters by province, districts, and sites, we can generate clean statistics showing processed beneficiaries, active beneficiaries, and the graduations. The data gives clear segregations such as split for pregnant women and children, and also by gender. This is what makes coordination meetings efficient. We do not debate estimates, we review the same report. And when you need to share it, one-click downloads the data for follow-up actions and evidence-based planning. Here is the same beneficiary report, but narrowed to a single site. For example, the Tehsil headquarter Nagar Parkar in district Thar Parkar. In seconds, a manager can see how many mothers and children are registered, how many currently active, and how many have been graduated in particularly Nagar Parkar, Thar Parkar. This is crucial for last mile problem solving. If a site shows low active follow-up or unusual drop-offs, we'll be able to intervene quickly, be it provision of support staff, addressing supply gaps, or strengthening outreach. The dashboard brings facility performance into a clear view. The next section, which is being shown, connects program coverage to nutrition risk. For example, we can see treatment status for mother and children. Most beneficiaries are in prevention, while a similar share requires CMAM support. Next, the malnutrition case mix shows where the burden sits across MAM, SAM, and complicated cases. It helps us prioritize early detection and timely referrals. And this is the same case, ma'am, you visited Peshawar and you are talking about to the doctors as well, about the early detections. Before moderate malnutrition becomes severe, with gender filters and time trends, partners can align outreach, supplies, and counseling where the risk is rising. This will clearly bring all Benazir Nashonuma partners together. This portal also tracks CMAM cases screening for pregnant and breastfeeding women. This will help us to view how many women are processed and how many MAM cases were identified in a geographical area. They are not just statistics, it is an early warning system. Provinces with higher identification rates can be prioritized for intensified counseling, micronutrient support, and stronger linkages to services. When mothers are protected, children start life with better chance. The dashboard adequately covers the full severity spectrum on the child CMAM. For example, MAM, SAM, and SAM with complications, plus the total identified and identification rate. This allows program leadership and the health partners to plan appropriately from community-based support stabilization care, which is being provided by WHO for complicated cases. It also strengthens accountability. We can track whether the identification is improving over time and where the highest burden sits. Most importantly, it connects the dashboard to life-saving action at the facility level. Beyond the beneficiary accounts, this dashboard captures what partners are delivering. Under the performance indicators, each partner has a structured result framework, activities indicators, targets, achievements, and the date last updated. For example, UNICEF being one of our core partners with an important mandate of social behavior change component, for them you can see community engagement reach, the strengthening of mother and father support groups, cooking demonstrations, and the orientation of lady health workers, all recorded transparently against the targets. This creates a shared culture of performances, not narrates alone, but measurable progress. As we explore more, we can see how this dashboard documents the full chain of support. For example, the strengthened referral pathways, updated behavior change strategies, advocacy dialogues and youth engagements, adolescent girls reaching to the VIFA, and critical supplies like MMS and RUTFs moving into the system. This is what integration looks like in practice, social protection linked to the health and nutrition services and supported by our real logistics. When these pieces are visible in one place, coordination becomes easier and bottlenecks becomes harder to ignore. Here we wanted to show you the partnership visibility. You can view the detailed indicators for one partner and then expand sections for others, such as WFP and WHO within the same performance indicators area where we saw UNICEF indicators. This reduces silos and duplications. In practical terms, it means that the format of monthly review meetings will change. We will open single dashboard and review everyone's progress at a glance and agree on joint actions. Similarly to UNICEF, the WHO is another partner with a very clear, distinctive, and important role in the program, and dashboard brings the clinical outcomes into the same transparency space. We see admissions for severe acute malnourishment with complications, counseling coverage for caregivers, nutrition stabilization centers, and health worker training. This helps in early identification for complicated cases, effective treatment, and strong system supporting recovery. Now our task is to use the data, update it regularly, and act on it. So every child gets the chance to thrive. So this is my last slide, and I'm sorry for boring you. I wanted to take this a little deeper into the program implementation, and probably last 1 minute of my presentation. You also see in detail the WFP section, which shows the operational backbone of the program, the enrollment progress, specialized nutrition food distribution, and the establishment of functional facilitation centers. It also tracks whether the systems are fully operational, including the facility reporting and case management platforms, alongside the routine reporting outputs. For BISP and partners, this is vital. It tells us not only what we want to achieve, but whether the machinery to deliver is functioning at a scale. I would like to highlight that it would also facilitate other partners such as Asian Development Bank, World Bank, KfW, GIZ, and others in tracking measurable progress against various indicators linked in their current or upcoming programs. We truly believe that when operations are strong and backed with technological excellence, beneficiaries experience reliable and continuity. Thank you for all sparing this time and being part of this inauguration of the dashboard. We are truly honored that we have Federal Minister for Poverty Alleviation and Social Safety, Mr. Syed Imran Shah Sahib, besides our Chairperson, Senator Rubina Khalid Sahiba, Secretary Poverty Alleviation, Naveed Ahmed Sheikh Sahib, and all our distinguished dignitaries from development partners. Special thanks to WFP, Madam Coco, Thomas, Dr. Lou, from KfW, Madam Sharmila as well. So, and obviously the project management unit who have worked tirelessly to bring this idea into reality, and our BISP colleagues and beneficiary families for gracing this occasion. So thank you very much once again. Thank you very much.